as soon as I sent Marcel the title for my talk, I regretted it because obviously it's a very presumptuous statement. But then again, I have an answer, and the answer is a chicken. Amit has her monkey. We have our chicken, and for you to understand that, you have to bear with me for the next 15 minutes or so, hopefully a little bit longer. And so what I'm not going to talk about today is obviously design has a great impact on health or healthcare systems, treatment, etc., as other kind of domains or faculties of life do. I'm not going to talk today about quote unquote the obvious, meaning design thinking, user experience, how to build experiences, services, etc., not because it's not important. It's extremely important, but because I want to focus on how kind of small stories or small changes can make hopefully great impacts on great problems. And so let's start by very quickly, I guess, go over what's wrong with health. Is there to fix? Obviously, as Gabriel has mentioned, there are many things that are wrong in healthcare systems. I'll focus on 3 or 4 of them. So it's a pretty redundant statement, borderline stupid, but it's actually quite true. It's very hard for us as people to, when healthy, when feeling well, to understand that we're actually going to get sick. I'm a healthy person who had a heart attack 3 years ago. I still consider myself a healthy person who just had a heart attack 3 years ago. When we feel well, it's really hard for us to grasp the fact that we're going to get sick. Therefore, we have to prepare somehow. Let me give you a very sinister example, knock on wood, knock on everything. Let's say 100% of you have been diagnosed, God forbid, with cancer, right? At early stage, there's treatment, there's hope. And let's say I give you a pill. It's true. There are drugs that I can offer you and that can promise you a healthy lifestyle and healthy life if only you take the pill once a day for the rest of your life. Now, statistically speaking, 60% of you will stop taking the drug somewhere between 12 and 18 months after, knowing perfectly well that this drug, this pill is going to save your life. Still, we do that. Why? Because we're people. It's hard for us when feeling well to understand that we're actually going to get sick. That's a problem. Now, for our doctors, physicians, our caregivers, there's a different problem. That is, it's hard to diagnose what's going to be wrong with us when we feel well, when our body functions well. Obviously, we have predictive medicine and predictive analytics, et cetera. So technology is moving in that direction, but still, it's much easier to diagnose diseases when we're actually sick. Again, it's a redundant statement, but it's a fundamental one that health systems are built around. Thirdly, as we all know, being sick is very expensive. It's mostly expensive to us. It's profit and our caregivers and the state kind of systems. And I think most of you know that, if you continue, we as a society, as civilization, the way we built right now, continue the way we are right now, health system are going to collapse. So change is imminent and effort is being made. Other stakeholders, of course, profit from it. And I'm going to talk a little bit about it in a couple of minutes. And yeah, we live longer statistically in some places, but that's the kind of the prediction, the assumption. Longevity and life expectancy is growing, especially in the Western world, but globally as well, which makes us more susceptible to different factors who see us as consumers. So that's a problem as well. So I'll just discuss kind of one aspect of it, and that is that the understanding of companies, of big systems, public systems as well as the private ones, that healthcare is changing. Healthcare is now a big business. Since it's very expensive to treat sick people, we should treat healthy people, preventive medicine, etc. And therefore, it opens up a whole kind of a plethora of new markets. And that's an approach many companies, especially in the States, of course, but not only, are taking. For example, I'll skip that for a second. I'll come back to that later on, maybe. So CVS, the gigantic pharmacy chain or franchise is getting into the medical services and acquiring companies left and right. And so do, for example, Best Buy. Best Buy, the consumer electronics company, is going into the medical business, services, medical devices. Again, they are putting billions, literally billions, into purchasing knowledge companies, technologies that gives them kind of a stranglehold on medical services, etc. Now, the question being whether I'm not judging whether it's right or wrong, whether it's good or bad, we don't know yet. But this kind of trend, this new phenomena of new type of medical service providers is interesting or troubling, depends on your point of view. So what solutions are kind of being pursued? Since we are in Design and Tech, Design Meets Tech conference, I'll try to present 2 point of views. Exponential medicine is an organization, a phenomena, a trend, if you will, kind of a spin of Singularity University, for all its cons and pros. And they have a yearly meetup in San Diego with extremely brilliant people and solution. Now, technology should be, taken always with a grain of salt, and it's hard to, or it's easy rather, to get excited about new technologies and new ventures and new solution. At the same time, we have to understand that technology sometimes is not the only solution. And so I'm going to give you a couple of examples from this. So this is just to show you Amar's law. So we get overly excited about technology at first, and then under kind of appreciated later on. Again, the kind of human quality of pursuing or perceiving new things. So a couple of projects that I found interesting because of the humane factor, and this is something that has been mentioned before, directly or indirectly by Gabriel and Amit, because they empower people, not as a cliche, but as a methodology and as a technology. So this Click Labs is a Swiss lab, and the person, these are 2 brothers. The person on the left, his name is David. He has Parkinson's. Pretty severe. He got it quite an early age. The person on his right is his brother. I forget his name. And his brother actually came to the lab, or at least one of the founders of the lab, as a friend, and asked literally to feel what his brother feels. And so what they did was build, I think this prototype of this system is a couple of years old. I think they have another version already. So David has, as you can see, some kind of wearable device. Technology or the technicality is really not important at this point. That basically diagnoses or feels his tremor, the myo signal or the myobio signal, the signal of the muscles, and transfers them to his brother. So whenever David feels a tremor or a seizure coming, his brother literally, physically feels that. Now, the idea is not, and the project is also called teleempathy, is not just to feel it physically, but to produce the consequences, the emotional consequences of such a physiological feeling, and that would be, in this case, empathy. Now, research showed that empathy or increased empathy also increases the willingness for care. So it's easy when it's your brother, but if it's been transferred to a caregiver, a doctor, a nurse, a clinician, then it might actually cause the treatment to be better. Eyal? Yeah, I'll say nothing on that. Okay. Yeah, that's the actual device. No, obviously, there's design in everything, right? And we can have a whole conference about this device alone, but not today. This is another very exciting company, United Neuroscience, and basically what they're producing, as it says, is endo-body. Well, that's a Freudian slip of someone. That's a typo. Endo-body vaccination. Wow, good for me. I should copyright that. So antibody vaccination in the sense that they produce vaccinations or vaccines that teach the body how to protect itself, and very cheaply. So their aim is to go under $1 per vaccine per person, right? And so obviously that's something you can distribute in the so-called third world, underdeveloped countries, etc. There are vaccinations that they're competing with who cost close to 100 grand a year, and that's their ultimate goal, to reduce the cost to that extent. So the secret, so-called secret, is actually unveiled. What we're trying to do with this, with the next 2 or 3 projects I'm going to show you and end with this talk, is that we're trying to, in a way, empower people, but again, not just as a philosophical academic statement, but in a pragmatic, practical way. So I'm going to show you a couple of examples. Projects that are not to that scale, they are kind of small, humble, some still in progress, but with potential impact. And so obviously, I'm sure all of you know of the Hole in the Wall project. If you don't, very briefly, a team of Indian educators literally put a computer literally in a hole, literally in a wall in one of New Delhi's slums, left it there for 3 months, then 6 and a year, etc., etc. The children there knew no English, knew nothing about technology. They hardly had access to running water, etc. And within 3 months, they just left it there. Within 3 months, the children learned English. They communicated with the researchers in English. They demanded new software. They demanded to increase the memory of the computer. They literally control. They were really fluent in Windows, graphic software, etc., etc., etc. This particular kid, the one on the right, was really eminent about replacing the mouse with a wireless mouse, etc., within 3 months. And so this is a landmark research, not just in my eyes, and not just in the educational field, but also in kind of the approach of letting people teach themselves, letting people find their own solution if you only give them the platform. And so under that effect, 5 years ago, we collaborated with the Carmel Medical Center, with the IVF clinic, in Bezalel, in one of our courses. And Shelley, one of our students, along with others, and it also relates to, in a way, to Gabriel's talk. So artificial insemination is a really tough process for all people involved. And the way it's been done, and I knew very little about that, being a man and not apparently, at least not yet, you extract somewhere between 30 and 50 eggs, depends on the country, depends on the hospital, depends on your medical insurance, from the woman's body. And then the eggs are being artificially inseminated, and 2, 3 to 5 out of those eggs are being injected back into the woman's body. Now, the question is how the 3 eggs are being chosen or selected out of those 40 or 50. And this is where the surprise came, and surprisingly, they are being selected only by aesthetic or external features alone, meaning their clarity under the microscope, their size, symmetry, etc. So basically the beauty, the aesthetic beauty of the morphology of the egg is determined in choosing whether you're going to have an 80% probability of having a successful pregnancy or not. And so the eggs at this point, and this is actually the protocol, and the eggs are being selected by the clinician, by a so-called expert. Now, the question that Shelley and her friends asked was, why is that? I mean, why? Who makes you an expert? Now, the simple answer is, yeah, me the clinician, I saw 5,000 patients already and 500,000 eggs, so I can identify. But maybe there's another way. So basically what they did was develop both a visual, technological, and also a service that allows the woman, the prospective mother, and the father to select their own eggs. Now, of course, there's risks to that. And it's not like we didn't have the time, obviously, to perform the necessary research. However, the question is still valid. So who made you expert? So maybe the actual naive eye will do a better job than the expert's eye. And that is a question with implication greater than this particular problem. And so this project, I can say very little about the what and the how. This is an ongoing project. Some of its authors are hopefully in the audience. Basically, it's a collaboration with Tokyo University. Again, it's an ongoing project. The idea is very simple. Can we take clinical information in a visual form and translate it to music? Not just sound, but to music. And the interesting question is not necessarily whether you can do that, no problem. But why music, and what can music can contribute to our understanding of the medical information? And so if you think about it, there's a cognitive and emotional process of translating complex information that is also scary at some point and misunderstood and incomprehensible to information that is extremely intuitive. So what we're trying to do is basically test or examine or research whether music as such can be an intuitive interface for complex data. And again, the concept here is helping us decipher information that in most cases is empowered by others. And by doing that, kind of transforming the power to us as patients. So that's part of an installation we just actually a couple of weeks ago deployed in Tokyo. Okay, and last but not least, going back to the chicken. So ReadRunner is a company I started with my Italian friends Remo and Gabriela about 5 years ago. Essentially, it's a reading platform for people with dyslexia, mostly children. It's a so-called quote-unquote smart system in the sense that it allows the child to read in a very safe and playful environment. We record the actions, collect the data, analyze it, and analyze the performance, and provide the caregivers, the teacher, the parent, the clinician, with information about the person's performance and the patterns along a timeline. And one of the things that kids can do is choose an avatar. It turns out that most kids chose the chicken as an avatar, the kind of a companion that takes them along the way of the reading, literally along the lines. What we found out was that recording their voices, because that's part of the data we collect, we actually record, many of them read out loud to themselves while reading. It helps them. So we record their voices, and we found out that the one who chose the chickens actually made chicken voices before reading, like the clock, like the hand clock, like pop, pop, pop. Maybe, I don't know, I don't know if the audio file will work. Yeah, it didn't. Well, thank you. But they actually make the sound. I think the hen clucks and the rooster crows or something, right? But that's not the interesting part. The interesting part was that statistically speaking, the ones who made the sound, the chicken sounds, had better performances. So somehow making the noise, making the sound, clucking helped them read. Now, we don't know what that is. I mean, we have our assumption, and your ideas at this point are as good as ours. But this is something, kind of a serendipitous situation where designing a system may come up with a better solution, in this case, for reading. Again, small example with hopefully a great impact. And with that, before lunch, when you think about what kind of meat you're going to have, then think about a chicken. Thank you very much.